name is Alice Bufkin, and I am the Early Opportunities Policy Associate with Texans Care for Children. This session we saw some much-needed return of funding that was lost last session for women's preventive health care and for early childhood intervention. And we also saw some positive infant and maternal health bills. But we also have some areas that we're going to keep needing to monitor as we move forward to make sure that moms and kids get the services they need. As we know, ensuring a healthy start for our babies means making sure that moms are healthy too. When moms get the help and resources that they need early on, we see the positive impacts, not just for moms, but also for babies and families. Women's preventive healthcare funding was one of the areas hardest hit last session. That area saw about a 2/3 budget cut in addition to a tiered funding system. Together, these legislative decisions led to about almost 60 clinics closing, as well as about 147,000 women losing access to care. This session, advocates like Texans Care asked the legislature to restore that funding. The legislature responded by putting funding in three primary funding strategies: the Texas Women's Health Program, family planning services, and the expansion of the primary health care program. In 2011, as a result of the state deciding to limit which providers could provide services through the Medicaid Women's Health Program, the federal government withdrew its 90% federal match for that program. The state decided to continue that program moving forward and rename it the Texas Women's Health Program, but all of the funding will now be coming directly from the state rather than having that 90% federal match as well. Normally, the federal government provides Title X funds directly to the state in the past, and then that funding has been used for family planning services. This year, though, the federal government decided instead to award that funding to a private network of family planning providers. The legislature this session decided to continue funding that program and replace that $32 million in lost federal funding with state funding. This is great news because it means we will benefit from the state program as well as the private network. And then the third strategy is the expansion of the primary health care program, which was one of the biggest changes this session. The legislature added $100 million to that expansion, about 60% of which will be used for family planning services. Although this added funding for women's preventive health care is great news for the state, there are quite a few challenges we'll need to focus on as we move forward. The family planning infrastructure was really badly damaged last session as a result of funding cuts and other budget decisions, and quite a few providers are still excluded from all the state funding streams. So moving forward, we'll really have to make sure that we have enough providers across the state to really use those funds, particularly in rural areas. We'll also need to make sure that all these different funding streams are coordinating with each other to make sure that they're really providing the services to women across the state who need them. This session, there were also a number of bills that are going to have some positive impacts for infant and maternal health in the state. One of these, SB 495, establishes a maternal mortality and morbidity review board to look at the causes of maternal mortality and severe maternal morbidity. Another of these bills will establish a task force on domestic violence that, among other things, will look at the impact of domestic violence on infant and maternal mortality and infant and maternal health. Another bill that will have some positive impacts will be HB 15. This bill establishes neonatal and maternal levels of care designations in the state. Other positive bills for infant and maternal health include bills that increase protections for children against vaccine-preventable diseases, a bill authorizing the screenings for congenital heart disease, as well as a bill establishing a pregnancy medical home pilot program in Harris County. Thank you to the Texas Women's Healthcare Coalition for really bringing together a lot of different voices for women's preventive healthcare. Thank you to everyone who came in and testified on behalf of the issues that were important to them and important to children in our state.